Welcome, everyone. Today we are going to explore a topic that is increasingly gaining attention in rehabilitation. That is vibration therapy, an important topic, but not from a commercial or superficial perspective. We will discuss it for neurophysiological and mainly interdisciplinary point of view that we are in the NPR International School. And I am honored to have with us Professor Dr. Sayed Warris, that is professor in our school, but also is the coordinator of the NPR International India and Man, and is a very, very expert in vibration based approaches. Dr. Sayed, thank you so much to be here with us, and we will start our presentation. Okay, Dr. Sayed, we are here. How are you? Welcome again to our school, the NPR International School. Now you are our director, our coordinator in India. Very, very important work and very heavy work to push NPR. How are you? How are you doing there in your country?
Hello, Professor. I am absolutely fine, and it's my privilege, and I thank you for choosing me for a great and noble profession over here. And I'm thankful for the viewers who are listening to us over here today regarding the vibration science under the School of MPR Science. So we are going to explore a lot today, as Doctor has already mentioned today.
Okay, we start our interview. Listen, when people hear the term vibration therapy, many things of them thinks about the massage guns, tools. From a scientific standpoint, what is exactly the vibration therapy truly about? So, we are not simply working on muscles. We are communicating with other system of the body. That is correct, Professor Sayed.
Actually, the concept of vibration therapy is more to the body, spirit, and soul. Uh, we all are vibrational beings. The vibration is not only confined to the devices or to massaging or to whatever comes in our mind. The basic thing is if we go back to our school days where we studied about the equations, there was a equation given by Sir de Broglie. He was a French scientist who said who actually experimented on a particle. He's told that matter has we call it wave particle dualism. A matter has uh, two natures, a particle nature and the wave nature. This gave arise to a concept that if matter is having two natures, a wave nature and a particle nature, so a human body, our cell, our body is also composed of matter. So we also will be having both the things together, like the particle nature and the wave nature. And keeping in view, many scientists had a study that human cells, when they were observed under piezoelectric sensors, they found that each muscle cell vibrates at a frequency of 8 to 12 hertz. And this concept was developed and keeping in view that human body is also having a vibrational part within it. The concept kept on into the research part of wave. In the research point of view, what they found that when a cell is having the vibrational frequency of 8 to 12 hertz, so we consider it as a healthy cell. When it is, when we consider it as a when a disease happens. What is a disease actually? A disease is when the cell is not having the same frequency, and it is altered by its environment. Like if we go in if we take an example of a aquarium where the fishes are freely moving. If we disturb the environment of the fishes, the water, we make it full of dust, dirt, and all the things, the fishes will eventually not move around, and lastly they die. Similarly, the cells are in the extracellular matrix. The the condition of the cell depends upon the quality of the matrix around it. When the quality of the matrix is healthy, the cell is healthy and its frequency is maintained. When we call it disease, when the matrix is not healthy and there is no, because all the transportation in and out of the cell happens within this extracellular matrix. So, keeping all in view, uh, this concept kept on the research point of view. Everybody was researching on these things, and the devices were made to help these cells to regain its frequency. And the idea of this vibration therapy eventually originated in the space science with the concept of biomechanical stimulation of the whole body vibration. And this concept was in 1856, and Russian physician Dr. Gustav Zender, he developed a mechanical chair in which he added some pulleys and all to create a vibrational sense, so to elevate the constipation. If there is any pain, it helped him to gain the massaging effect in his body to reduce the constipation and to get himself very healthy. This concept then was again taken in 1895 by Dr. Kellogg. He helped. He also invented a chair in which he tried to mobilize his patients within the chair, and he found that the circulation also improved, and the stimulation of the body helped a lot in relaxing the patients. With this concept, the Russia, as you know, that the Russia was the first to start up the space program. And what they were telling, they used to first clinically check the astronauts who were going into the space. And what they found that uh, first evaluation was given, an assessment was taken of the astronauts, evaluation was done, and on returning back from the space project, the astronauts were having the wasting of the muscles, the weak bones, and all. They found that they need some device which will mechanically help them to gain the muscle strength, to get them a little bit of strength in the muscles, the strong bones and all. And then the NASA take the project. The NASA, which is the space academy in USA, they started developing this concept that whole body vibration will really help them, because our body is very much connected to the whole body vibration. uh, we are, as I told you in the initial times, that we all are vibrational beings. So this vibration externally gives a soothing effect, not to the muscles only, but to the bones, to the nervous system, and all. And this concept started as a whole body vibration. This gave like a new room to the research.
Okay, we carry on with the question, Professor Sayed. We're talking about now regarding postural rehabilitation. How can vibration therapy support patients with postural imbalances?
Posture plays a very pivotal role in our day-to-day life. And posture, whenever there is a bad posture, um, it will be either drooped posture, kyphotic posture, sclerotic posture, leaned posture. Many types of postural deformities are there, and it can arise because of muscular imbalance, because of pain, or because of some bony issues. How this vibration therapy will help us to release it? Now it depends upon the device which we select, because we have to select a proper device, proper vibrational device for clearing up the things. For example, if a person is having kyphotic posture, or a straight neck, loss of lordotic curve of the neck, loss of lordotic curve in the lumbar region. If there is a straightening of the cervical spine, straightening of the lumbar spine, it maybe there is a spasm in the muscle and all. To reduce the spasm, this my vibration therapy plays a very pivotal role. Pain is the cells crying for oxygen, yearning for oxygen. Pain is the cells asking for oxygen, because if we see, there is a connectivity within our body, the connectivity of the cell. When cell is healthy, a healthy cell connects to the healthy tissue, a healthy tissue to the healthy organ, and healthy organ to the healthy organ system. If there is any deprivation of oxygen to a cell, it is deprivation to the tissue, to the organ, and to the organ system. So, to fully relax, to give the normal frequency, best nutrition to the cell, the matrix of the cell should be, the extracellular matrix of the cell should be healthy enough. And it should, again, our skeletal muscle cells vibrate at 8 to 12 hertz. So we have to give externally the same frequency if there is a loss of frequency because of the muscle spasm. See, a healthy spasm is always very relaxed muscle. A relaxed muscle is having a full oxygen supply. If there is hardness in the muscle, so for example, a person dies, what happens? His body becomes very rigid, rigor mortis. What is rigor mortis? Rigor mortis is the tightness of the body, because there is no oxygen now in the body. So the cell needs oxygen. So we externally give the same frequency, and releasing the spasm and relieving the spasm, and the patient comes into the normal action. As in our MPR science, we call that we derail, then rerail, uh, rerail the things. Like, if the body, the concept of our MPR science is the posture. If it is bad, we will recorrect it, making it aligned again. Our alignment depends only on the external input of the vibration therapy, what we are going to release the spasm. When the spasm is released, the bony structure comes into the natural formation. But with this vibration therapy, not only we have to depend on the vibration therapy, but we need to first diagnose it. For diagnosis of the posture, we have posture meter, which helps in diagnosing the correct posture of the body. And after that, what we will do, we will align it in a proper way and re-educate the our patients regarding how to maintain the posture and all. And vibration therapy is helping overall to relax the muscle, to improve the circulation, to sensibilize the nervous system, and to support in the strength of the bony structure of the body.
Very interesting, Dr. Sayed. But now another question, because we're talking about posture. But now we concentrate in craniofacial system. We concentrate in dentistry. Can vibration therapy influence the masticatory muscles?
Absolutely wonderful question, doctor. And of course, um, when we talk about the muscles of the face, muscles of the mouth, and all. In the field of dentistry, again, I will come to one thing, that to improve the circulation of the and to decrease the spasm, if there is any spasm in the buccinator muscles and the oral aperture, what we do, we have another device which is a vibration device. We call it Z vibes, and it is having a lot of excellent result with respect to the tongue strengthening, tongue locomotion, and tongue motions, and the fascia within the facial region. Externally, we can do the matrix rhythm therapy, and internally with the Z vibes. Like internally, we have a device known as Z vibes, which helps in uh, rehabilitating the oral musculature, especially when we I can give you an example of the cerebral palsy children. Cerebral palsy children, they will be having dysphagia, and dysphagia, and as well as they will be having drooping of the saliva from one side of the mouth, angulation of the mouth is increased, or sometimes we talk about facial palsy cases in paralysis patients with stroke, or we can talk about the Bell's palsy cases with the infection in the ear, which leads to Bell's palsy and Bell's phenomena of the eye. We can help with that with vibration therapy.
Okay, Professor Sayed, we carry on with the questions today. We're talking about now sports medicines. What role that it play in performance and recovery for athletes? Can you explain that for us, please?
Yes, so wonderful question, and I'm here delighted to answer on this. Regarding the sports rehabilitation, pre and post workouts and sessions, we have whole body vibration. Whole body vibration therapy, we are having the predefined exercise therapies. Like I will tell you, doctor, the most important thing is that when we are doing a high performance sports, our 80 to 90% of muscle fibers are working. When we are doing normal sports, 50 to 60% of muscle fibers are working. But when we are on the vibration platform, 100% muscle fibers are working. How? When you are on the vibration platform, the vibration starts doing uh, contraction and relaxation of the muscles continuously with our subconscious reflexes. Our subconscious reflexes are stimulated by whole body vibration therapy, and so there are predefined these postures which we have to maintain on the whole body vibration, like for the stretching, strengthening, and even we can use therabands, therapoles, wobbler boards for balance training. We can have stretch bands, we can have parallel ropes to rehabilitate, to strengthen our muscles. And also for cool down, like after the performance of warm up and all, cool down also can be done by putting our legs in a particular posture which will be taught by the vibration expert, to be on the vibration platform, to relax the calf muscles, to relax our upper body, cool down stretches. This whole body vibration therapy is like a light in darkness for the sports persons. Like it's a really a great innovative science for these sports persons. And nowadays all the studios, those who are training the athletes, they are having this vibration, whole body vibration therapy machines within their compounds. And only the thing is, the expert should be there to rule out the things, to make their proper assessment, to see their needs, to know their after assessment taking what they need, what they require, they design the protocol for them and put on the whole body vibration therapy for them.
Okay, Professor Sayed, very interesting that you are talking with us, with all our audience in our school. And we're talking now about neurological and pediatric cases. Very important. Are there application in neurological patients or pediatric rehabilitation? That is prevention for the future, and that will be very, very interesting. Please answer this question, Dr. Sayed.
Yes, indeed. It's having a very pivotal role in pediatrics as well as geriatrics and neurological cases. If we take neurological cases, most commonly, I am working on Parkinson's, stroke patients, and all. Uh, Again, doctor, it depends upon the assessment intake. After taking the proper assessment, we check out the things what where the patient requires this rehabilitation therapy, this whole body vibration or uh, instrumental assisted vibration therapy. For example, patient with tight muscles, because if we talk about neurological cases, if I take an example of mm, say stroke, in stroke what happens, there is a flaccid paralysis followed by spastic paralysis. The muscle, there are muscle changes, flaccidity is followed by spasticity. If spasticity is not managed properly, it goes for the contracture. If the contracture is not managed properly, it will go to deformity, and deformity will lead to handicap. So what we will do, we usually release the tight muscles by vibration therapy and then add the exercise protocol on it, and functional movements, functional goal oriented movements we prescribe for them. But we will check if there is any tightness, high spastic muscles, high tight muscles, or if there is also flaccidity. To induce the spasticity also, we use this vibration therapy. And with respect to the Parkinson's patient, they are having the shaking palsy, we call it. They will also have the shaking of the hands and the muscles. We also introduce this whole body vibration therapy, as well as, depending upon the case, what level of the case is. That's why it's very important to take an assessment before applying the vibration therapy. With respect to the pediatrics, we usually have this for uh, pediatrics, in pediatric conditions like cerebral palsy, and there are many types of cerebral palsy like ethetoid type and monoplegic, diplegic. It depends upon the, and even in case of delayed milestones also, we use this whole body, this matrix rhythm therapy and other vibration devices. For their oral rehabilitation, we use the Z vibes, and depending upon the case. But very important is to assess the case first and check where all we target the things. Like, for example, if a child is having contracted knees, tightness in the knees, knee joints, so we release the hamstrings, we release the quadriceps, we release the calf muscles, and we keep on doing this session. It's time consuming, but we have to do it to get a proper result of it.
That's very, very, very interesting to say. It's a very interesting topic, the vibration therapy. For people who do not understand that, that will be clarified. That, but listen, today we see vibration devices everywhere: gyms, social media, wellness centers. What differentiates a clinical application from a casual or commercial one? And that is an important question.
Very excellent question, doctor. As I told you that the frequency and all depends upon the case you are looking at. As I told you that our body is having 8 to 12 hertz of frequency cells, skeletal muscle cells, which are there vibrating at 8 to 12 hertz. Our goal is to come in between that frequency. when you are locally giving any kind of vibration therapy. What makes matrix rhythm therapy different from other gadgets which are available in the market? When you apply matrix rhythm therapy on a soft tissue in a particular way, sometimes it stops and then again restarts itself. Why? Because it is not harming the tissue. It is checking if the tissue is having any adhesion formation. It will stop over there. It will correct it and again go a little bit further on. While as other rehabilitation device, other vibration devices, what you are, when you apply it on the skin or on the muscle bulk, it will continuously vibrate. It will not stop at all. This makes matrix rhythm therapy, because the concept of the matrix rhythm therapy is that the healer is within you and it is just activating it. It's just giving us boost to it. And uh, selecting the frequencies on the whole wide body vibration and to the uh, theraguns which are available in the market, or the frequency of the Z vibes and all, it all depends upon the assessment intake of the patient. When you assess the patient, when you assess the athlete, when you assess your client, you have to then select it. When you study this vibration therapy in a proper way, in a depth, then you will come to know how to select what will be the frequency, and all depends upon the patient, because every person is different with respect to the alignments. But as a communication, we are all same, we are all connected to each other, as you told in your beginning of the speech, professor, that connection is very important, what we are going to speak about. Like I told you that we are connected to each other. This is the concept of the MPR science. We are connected biologically to each other, and to earth we are connected chemically, and to entire universe we are connected atomically. So all depends upon, we are human beings all same, but our alignment inside, like everybody else, somebody is having a headache, somebody is having shoulder pain, somebody hand pain. So it all depends upon the person what he complains of. So we need to take a detailed assessment and select the frequency, select the device, and then apply it on the patient to get the better result.
Okay, that's very interesting. All the topics are very interesting. But I think our audience want to know also about courses, about formation, because our school is an international school in all around the world, and also that we are talking now in Middle East. Okay, uh, Dr. Sayed, you have developed structured courses inside our education platform. I know that. What will be the professionals that can learn and enroll in this kind of courses?
Our school has built up, now the program is with our school, MPR Science School, which we have developed, this whole body vibration therapy. This is open for all the healthcare professionals, fitness trainers, uh, the gym instructors. It's for all the health related things and the fitness related industries and all. And what our concept is that we, in our school app, we have the program already uploaded, the course, and we have hands-on program as well, hands-on practical sessions. And that is like, we make sure the person who is going to train within our school, we make sure that he comes out as an expert with flying colors.
And we are right to the end of the video. Now, uh, I want to give a message for all of you, to give to professionals who are considering integrating vibration therapy into their practice, into the concept of the NPR science. Modern rehabilitations requires tools that communicate with the nervous central system. We know that vibration therapy is not a trend. It is applied neurophysiologically. And we invite all of you to join our courses inside our web application and deepen your understanding the powerful therapeutic approach. That is our invitation for all of you. We have an open application. I will show you now the application and you will see how register into it and how can start to study with us. Thank you to be here and we will go into the final message for all of you. Okay, and this is our application as you see there. Our application is a free application. You can register in, you can enroll into the application. You see something about our school all around the world and all the courses. All the courses. If you go here, you can see the different courses and also the course of vibration therapy. If we go here and we type vibration, it will show you the course. This is the course of vibration therapy. If you go in, you will see you can access to the course. You can see what is the course regarding all. Here you have the Info Silverstone, that is the company who deal with our courses for some information. You have here both of us and the models here. You will see this is free just to you understand what is. You have a model here about different type of vibration platforms. You have the vibration exercises. You will have here the effect of vibration therapy. We have another model here, different type of vibration therapy. You will have here the NPR fundamental concepts to understand the concepts of NPR because it's important in our school to understand. And you will have here the posturology basis also for you. You will have here the posturometry basis here, and you will have here craniofacial system also. It's a very complete course. And here you will have the ebook of Dr. Sayed. As you see, it's a very, very complete course. You see, and you will sign into an application for free. And when you are into the application, you will see the whole courses we have there. We have in all languages. We have courses of posturometry also. You have courses for dentists. You have courses for rehabilitation. It's a very complete formation in our school. You have a lot of. You have free videos also in the application. You hear free videos in English, free videos in Spanish, etc., etc., etc. As you see, is a very, very, very important education in there. All right. And if you are interested, you know our application, how you go in, and then we will arrive to the final message just to present our school. Because as you know, we just opened the NPR International School of Middle East that is coordinated in India and Oman for Dr. Professor Sayed and in Emirates for Dr. Osman, as you see him, because we did another video presentation. Be in contact with us, follow us in our channel, in our media, in our social, to be informated. And if you register into application for free, you have a lot of notice there for free. And obviously you will have all courses.
Thanks a lot, the professor, for inviting me over here, and thanks a lot to our audience who are listening to us. And my message is that rhythm is life, and life is rhythm. And there is a combination that our body is in a harmony when it is mutually connected. A healthy body, a healthy mind, and a healthy soul makes a symphony of life. Thank you, Doctor.
Okay, our fellows, I hope you enjoyed the video. And as everybody say in YouTube and in social, if you like it, register in our school, register in our channel, share this information for everybody. Because if you share it, they will arrive for everybody all around the world. As you say, as you see there, we are all around the world. Share the video, register, do a like, and we see you in the next video in our school and in our social media. Bye bye, everybody.